Hi, everyone. Today, we are lucky to have one of the co-authors for How Healers Heal, Dr. Karmi Patel. I'm so excited for you to meet her and read her chapter in the book and everything that she shares, but we're going to give you a mini intro to that now. Dr. Patel, can you introduce yourself?
Hello, everybody. Thank you, Silpreet, for having me. And it's been an honor. I am a lifestyle medicine physician and internal medicine physician who works in primary care. And I've been in practice for more than 16 years now.
Welcome. So how did you first get introduced to lifestyle medicine?
Okay, that's a good question. It has been a lot of a transition journey for me. It was, through personal exposure to, patient-related issues that came up that made me think about how I was practicing medicine in terms of just prescribing medicine versus doing things to avoid diseases like high blood pressure, diabetes. And I felt like I didn't have enough knowledge about nutrition. And so that led me to clinically look up things on how I can do or educate myself to better help my patients. And then at the same time, I had a little bit of physical struggles in terms of illness in my toddler that led me to even more dwell into things about foods and what we're eating and what am I putting into his belly. That led me to look up documentaries. Actually, it was my husband who came across Forks Over Knives documentary, and we looked at and found Dr. Greger on there. And then I looked him up and saw his book, started reading that. So it was a gradual journey. And then I got introduced officially to lifestyle medicine by one of my friends, Dr. Kaushik Reddy. And he was going for lifestyle medicine conference, and he was like, you got to come along. And when we went, it was like, oh my God, we have found our tribe. So it was over the span of 4 or 5 years that I got introduced into it. And it's been, since then I took the boards, and it's been another 5, 6 years, and definitely have found a good tribe now.
And I know you mean a tribe of doctors that
Yes.
share your philosophy about how to treat patients. And I know your practice has shifted entirely from the regular family practice to a more lifestyle medicine based family practice. So how do you incorporate it into your practice on a day-to-day basis?
Right. So it's a good complement, and I think in general, lifestyle medicine is what medicine should be, because any diseases, most of the chronic diseases that you look at, with high blood pressure, diabetes, cholesterol, obesity, all of those are rooted into what we do with our life in terms of food choices, activity choices, stress management, sleep patterns and things like that. So we have to counsel patients on those lifestyle management issues first and then do medication. And although sometimes we need to do both of those coexisting together, so I'm not all for like not doing medicine at all. That's not the point of lifestyle medicine. The point of the lifestyle medicine is to really make sure that you are taking care of all the changes that you can make or factors that contribute to those diseases that can be managed, or optimize your health in general. So in terms of my daily practices, what has changed for me personally is rather than just, diagnosing a disease and prescribing a medicine for that disease, that which we were, taught so highly in medical school to look at, I can also step back and figure out whether patients are ready or motivated to change, or can I motivate them to make a change in their lifestyle, talk about things that they can change. Can I get them to eat like maybe an apple a day? So I feel more comfortable in having different tools besides just medicine to help them heal.
And that's wonderful. I think that's what we've all found. And the stories in this book are just incredible. I'm sure you've read some of them. Why should other people, both doctors and non-doctors, healthcare professionals, and patients, read this book?
Right. So I'll, do two sorts of the questions. First, on why physicians should read the book or other providers should read the book. I think it's because they will find themselves that they will relate to so many of these authors and doctors' stories, because most of them have been integrated in the same residency knowledge and things like that. And now, as you know, over the years with the administrative burden that we feel and the COVID burden that we got, there's a lot of emotional burnout, physical burnout, and we're not taking care of ourselves. The self-care is always like least of our priorities. So when we are seeing these stories as physicians, you're going to find your tribe. I guarantee you that you will relate to that and you will feel like, oh my God, this is my story, And second, it will open up doors to see windows into opportunities of figuring things out for yourself and educating yourself, taking that extra step in gaining knowledge. And for me, it was like, it has been my solution for burnout, on how I can emotionally keep going for myself and my patients. And the second part on why common people or patients should read the book is again the same thing, because they will also see some patient stories that are in the book, some patient letters that are in the book, and challenge themselves and their physicians, because sometimes they might be the ones who might say, hey, doctor, do you think there's other ways that I can make a change? Because we as physicians know that we were not all taught the same. So I've had, patients in my practice that have came to me and asked for certain things that makes me want to research it or look up things. So that might be another window of opportunity for a patient and doctor both to educate themselves.
I agree with the first part that you said. I mean, a common theme throughout the whole book is burnout for
Yes.
healthcare professionals. And lifestyle medicine seems to be a very good structured format to help yourself with burnout, because we don't want to be the victim. We want to take charge of our health and have a growth mentality to move forward.
Exactly.
And it's just so motivating to see that doctors are human, and maybe sometimes people or patients forget that, but it's
Yes, yeah. I think
important.
we ourselves forget that, right? Because we have like all these, we feel like we're superhumans and we have this wall, surrounding us that we don't let things or emotions get to us, but it does. It's just that we have equipped ourselves to move on from it, from one case to the next. And that all those things or emotions get buried under, and we've never had time to open up or react to it or, close the chapter in a way about it, and I think with lifestyle medicine and having that camaraderie with other people and sharing your emotions and having that tribe, I think is a very good solution for burnout.
So can you give our readers and viewers your number one takeaway for implementing lifestyle changes?
Yes. So what I always tell my patients is that this is lifestyle change. That means this is something that you got to do for the rest of your life. Okay. So this is not a fad diet. This is not some crash course where you just do it for a few weeks or a few days because your doctor said so. Because then we're going to crash down and we'll be back to the back habits. So whatever you do, you have to make sure you can do it for the rest of your life. So if it is 1 apple a day, then just start with 1 apple a day. But have to be something that we can continue doing for the rest of our life.
And I just want you to do 2 more questions. I'm sorry, I give you 2-parters. 1, anything else you want to add? And 2, where can people find you and connect with you?
Okay. So I think this is just a great book, and I am just thrilled and excited that so many of us, I think it's 33 authors that we have that have come together to share this. And Dr. Pradhan has done a great job of compiling and coordinating this thing. So I'm very excited, and I hope when the book comes out, everybody will be also just as excited and thrilled as we are to share our stories. where people can find me. I work for Department of Veteran Affairs in Knoxville, so I take care of veterans. And in terms of other social presence, I am on Twitter and on Instagram.
Thank you so much, Dr. Patel. I'm so excited that you're in the book. I don't want to give away your chapter, but it is so powerful. And the patient story you shared is incredible. Everyone should read your chapter for sure. Thank you so much.
Thank you. Thank you for having me. Take care.
Bye.
Bye.